Depression, dementia, and delirium are all complex conditions that can affect an individual at any stage throughout their life, although more common of an older age. Depression is the feeling of being sad, miserable, or feeling down, a loss of interest or pleasure in activities that the person previously brought joy or happiness in, and there can be physical changes with depression, which is weight loss or weight gain, digestive upset, and feeling nauseous. Dementia is a progressive deterioration of a cognitive function and their thinking, remembering, and reasoning. This generally occurs in the elderly, but can occur in younger clients. Delirium is the acute confusion in which an individual's mental ability is affected. This can be related to other acute conditions, such as seen in the elderly, a UTI or chest infection. It occurs with patients with mental illness or it can be drug-induced. The clinical reasoning cycle is a tool used by healthcare professionals to collect, process information, understand the patient's medical situation or problem, create a plan, and implement appropriate medical interventions, and then evaluate those outcomes and assist in helping to learn how to care for the individual. Some assessments used to determine whether an individual or a client is suffering from dementia, depression, or delirium is the DSM-5, which is a handbook used by healthcare professionals and a guide to help diagnose mental disorders. Patients with depression can use behavioural therapy. This identifies and assists the individual to change potentially self-destructive or unhealthy behaviours. It functions on the idea that all behaviours are learned and that an unhealthy behaviour can be altered or changed over time. Cognitive therapy, a relationship between the amount and severity of an individual's negative thoughts and the severity of their depressive symptoms. For example, the more negative they think, the more depressive thoughts that will occur. A mental state assessment is also conducted on mentally ill patients. This involves appearance, so we're looking at distinctive features, clothing, grooming, and if they're hygienic. So as you can see in this comparison, the individual on the left appears quite unkempt, ungroomed, and doesn't really look like he looks after himself. So a patient or a client of that appearance is commonly seen in depression because they lack in self-worth, whereas the client on the right-hand side appears well-groomed, neat and tidy, and that normally occurs in a less mentally ill client as they have more self-worth. Their behaviour will be assessed. This is facial expressions, body language, posture, eye contact, social engagement, and if they're of an anxious or aggressive behaviour. Mood is also... This involves their level of mood, so whether it's elevated, lowered, or depressed, and their affect, which is the range. If they're quite blunt in appearance, they don't have much facial expression, for example, and their speech is also assessed. So that's the rate of the speech, whether it's fast or slow, the volume, the quantity, whether they don't say much at all or say quite a lot, and the ease of conversation. Cognition is also assessed, so that's their level of consciousness. So in drug-affected clients, that can be also assessed if they're alert, drowsy, intoxicated, or orientated. Thoughts are also assessed, which is delusions or false belief, if they've got overvalued ideas, depressive thoughts, suicide, harm, self-harm, or anxiety, and perception, which is illusions or hallucinations. Insight is also assessed, which is acknowledging their diagnosis, if they actually understand, and judgment, if they have problem-solving abilities or coping mechanisms in stressful situations. Also, a risk assessment can be conducted, and that's to identify any risks which might occur to the client, so that's just to remove them from any unsafe environments, to ensure that the nurse is quite empathetic and encouraging and monitor their medications for side effects and ingestion, and continually monitor their mental state. Education is important on sleep, nutrition, healthy eating, and drug use. The impact on others, it can be quite detrimental to an individual's family. It can cause financial stress, impact their social health, whereas they don't want to go out anymore and socialise with other members of the community. It can affect their emotional health and their overall health as well. So lack of nutrition can lead to insomnia. And the impact on the community, it can be a financial burden on the community by attending appointments and special clinics, which are quite expensive. And depression can also be linked to other chronic diseases as well. And in the workplace, the lack of concentration, not being able to get the client's work done.